Believing that a loved one has Alzheimer's, only to find out it isn't Alzheimer's at all, but a disease that mimics it. Tonight, News Channel 36 reporter Anjanette Flowers has the information that could change your loved one's life.
I thought the end of my life was coming.
73-year-old Warren Klickner is slowly getting back the life he lost.
I can't even explain how bad it is when you can't do anything. And I mean nothing. I was very active. And all of a sudden, I'm just nothing.
Nancy, his wife of 34 years, watched as her husband became a different person.
I noticed that he was less able to navigate, walk around. He was having some memory problems at that time.
As a nurse, she feared age had gotten the best of him.
Yeah, I thought it was Alzheimer's.
But for months, Nancy couldn't get Warren to see a doctor. But a fall in his bathroom gave him no choice.
There was no way I could get up, so she called the ambulance and they took me to the hospital. That's when they discovered that I had something wrong.
Hi, Mr. Klickner.
How are you?
Good to see you again.
Yep.
How are you feeling?
Good to see you. Pretty good.
Turns out that something was not Alzheimer's after all. It's a disease that mimics it, called normal pressure hydrocephalus, or NPH.
A condition in which spinal fluid builds up in the brain for causes we don't always understand.
Dr. Scott McClanahan with Carolina Neurosurgery and Spine Associates says there are three main symptoms associated with NPH.
A shuffling gait, a memory impairment, usually of recent memory, and also bladder control problems.
NPH can usually be detected with an MRI or CT scan. Unlike Alzheimer's, which is difficult to treat, NPH can be treated with surgery by implanting a shunt like this in the brain. It's been more than 7 months since he had the shunt implanted. The difference, he says, has been life-changing. Once again, he can cook, drive, and get the mail. Even his memory has returned.
I can do most of the things I want to do. But when you get old, things happen, you know.
As with any surgical procedure, there is the risk of infection and the possibility the results may not be what you hoped for. For more information on normal pressure hydrocephalus, log on to our website at Wcnc.com. Reporting from the newsroom for News Channel 36, I'm Anjanette Flowers.
Nice to know it all worked out for him. There are some recognizable signs of Alzheimer's, including problems doing simple tasks, difficulty talking with others, trouble solving problems, changes in mood and behavior, including poor judgment, and forgetting both recent and past events, as well as not recognizing those close to you. If you notice these symptoms in a loved one, you should talk with your doctor.